Welcome back. Today I want to talk to you about COVID-19 and hair loss. As we are in the middle of this pandemic, obviously you're aware of it, everybody is. We're noticing more and more patients coming into us now with severe, significant hair loss attributed to the COVID-19 infection. So I've been reviewing some literature, medical articles and everything have been published on the subject. It's still a fluid thing. We don't know exactly how the COVID-19 influences hair loss. So I can't tell you exactly the mechanism, but we are seeing more and more patients coming in now with pretty significant hair loss. Either they've had the COVID infection themselves and recovered, or went to the hospital and then recovered, obviously, or they've had someone in their family that had the infection and they went through a lot of stress and now they're experiencing hair loss. So we know that hair loss can be caused by stress, it can be accelerated by stress. And also the COVID-19 now seems to be an important factor. Again, we're not sure if it's the virus itself in a patient that has the COVID infection and recovered. We don't know if the hair loss is attributable to the virus itself, some damage to the hair follicle by the virus, or if the hair loss is secondary to the body's reaction to the viral infection and all the healing process. So that's yet to be determined. Regardless, it can be pretty scary. So that's why I wanted to shoot the video, because we're getting more and more questions about that. I'll show you an example of a patient that I saw here today and how significant the hair loss can be in just a second. So let's take a look at what hair loss from COVID-19 looks like. I have a picture here I want to show you. It can be pretty distressing. So if you are out there and if you're noticing this, every time you brush your hair or you shampoo and you're afraid of doing anything to your hair anymore because you think you're going to have no more hair left in a week or two if this continues, that's what we're hearing from patients. Really sharp, accelerated hair loss. Usually no symptoms. It's not that you have like itching or burning or pain in your scalp. You just notice that all of a sudden you start noticing more and more hair. Hairs on your clothes, hairs on your desk, certainly hairs when you brush. We all shed hairs every day, and we all have a certain number of hairs that we're used to seeing during those times, during the shower or the brushing, but you will notice a lot more hair coming out. So the sooner that you address this, the better. So don't let it go for too long before you call us, okay? But that's what it looks like, just a bunch of hair. If you could see really close here, sometimes it looks like the root of the hair, but it's really not the root, it's just the base of the hair follicle. So these hairs are still healthy under the skin, they can be recovered. The first thing we need to do is we need to stop the loss, control it, and then we'll start working on recovering the hair loss. So there you have it. If you're experiencing hair loss like that from the COVID, without the COVID, if you're not sure what your hair loss is caused by, that's what we're here for. That's all that we do, is specialize in hair loss. So give us a call, we'll talk to you, we'll help you figure this out. We can do online consultations. Now with the pandemic, we're offering that as well. We always did, but now even more. So I can try to assist you, try to help you figure this out. So just give us a call, schedule a free consultation, and we'll take it from there. Okay, the sooner you call, the sooner you address this hair loss, the more hair we can preserve and the quicker we recover. So don't waste any time, okay? Hope to see you soon.